And then we were also, of course, very happy to see that the STAR Act was reauthorized for another 5 years. And I know when you were involved with the original STAR Act, Children's Cancer Cause played a key role in, enacting what became the largest childhood cancer bill ever enacted. And was wondering if you have any thoughts or wanted to reflect on that and kind of where you see things going over the next few years.
Absolutely. So I'll talk about this from both the authorization and appropriations perspective. STAR is a wonderful achievement. It's consensus legislation that the Alliance for Childhood Cancer pushed forward, and we were a key player in that, as you said. STAR 1 was authorized 5 years ago, 4 years ago, and we for STAR 1, we led the way in drafting the survivorship provisions of that bill, and we're very active over the last couple of years in making sure all those provisions were implemented. We're thrilled that we had 3 Agency for Healthcare Research and Quality reports come out that really moved the research forward in this area, as well as a very important GAO report relating to survivorship. As far as the survivorship or the STAR 2 bill that was passed into law and signed by the president passed into law in December of 2022 and then signed by the president in January this year, we chaired the survivorship work group and then again helped draft the provisions that were included in the STAR 2.0. And then ultimately, not all of those provisions went through, but I think a very important one that works very well with the Wasserman-Schultz bill was included, and that would really promote, more research into these systems of care. So we're really very excited about that, and I think it's very important the bill was passed because that leads us into the appropriations process, and because now all of the provisions of STAR are authorized, it will help us as we work together as a community to make sure this year that the important provisions of STAR, from the survivorship provisions to the biorepository provisions and others, are funded at the levels we want.
Right, and as we've learned, it's much easier to get something passed if it's already in the budget as opposed to being introduced as a new spending. And I think, that speaks to the importance of, our community continuing to advocate for that funding as the next bill comes up, because as you mentioned, the money has to be appropriated each year. So we always urge people to go to children'scancercause.org and sign up for our advocacy alerts and participate in our voter voice program that we have. So as
Steve, I'd like to say that's really important. Having worked on the Hill as a health aide to 2 different senators, they really listen when they hear from their constituents, probably more than anything. That's obviously the key voice. So we can't encourage you enough to participate in our grassroots program.
Yeah, and when an office gets a letter, I know that they really keep track of the numbers of letters that come in or the number of calls that they receive. And I think sometimes people say, well, I'm just one voice. What does my letter mean? But from my experience, they really do count because they're constantly being monitored and